Hello, my name is Brett Zacklin, and this is my public health critical assignment showing the history of public health from antiquity to today. First, a little preview. What we will be talking about today are the major themes, advancements, and achievements throughout the history of public health, and demonstrate the direct impact on health and wellness. Another is the impact and control of environmental factors on public health. Also, the role of vaccines in public health and infectious disease. In addition, the role of governmental and non-governmental institutions that shape population health outcomes. The role of public health and healthcare access, and what I feel the future of public health will be or should be. There are various areas of the public health. The first is the antiquity till the 1830s, which is the health protection. Then hygiene movement, which is the 1840s to 1870s. The contagion control, which are the 1880s to 1940s. Filling holes in the medical care system from the 1950s to 1980s. Health promotion and disease prevention from the 1980s to the 2000s, and population health in the 21st century. In health protection in the antiquity to the 1830s, the focus was primarily on individual and community behaviors, meaning it was how people were supposed to live their lives in a certain way to have a healthier life for the community at large. The way in which this was done generally at these times were through religious and cultural norms or prohibitions. Some notable events were quarantines, sexual prohibitions, and dietary restrictions. The hygiene movement dealt more with sanitary conditions, and the actions were more of combating the environment at hand, like, for example, we will see later with Jon Snow and the cholera outbreak. Some notable events, again, is snow on cholera, Semmelweis and the puerperal fever, and some further epidemiological studies. Then next is contagion control, which dealt mostly with germ theory. The method of action was the communicable disease control, vaccination, sanatoriums, and outbreak investigations. Some notable events during that time are the TB sanatoriums, Goldberger and Pellagra. So first is the health protection, in the antiquity of 1830s. During this time, human settlement caused a greater population density, which brought about new issues that had not happened before, since people were a lot more spread out. So any sort of diseases were dealing more with certain small groups of people, so they would not spread as quickly. Also, because of sanitation, now everyone is beginning to drink out of the same water systems. That anything that could happen in the water would affect the public at large. In ancient Egypt, they used healing arts that included magic, sorcery, and various forms of embalming. They also were very well known for using wide varieties of plant materials and had a large pharmacopoeia. Also, archaeologists have found skulls that indicate that they practiced drilling holes in the skulls to treat certain conditions, which is interesting because that is something that has been even carried on through the later times. Another ancient civilization that had done a lot for public health, really, are the ancient Greeks. They were very well known for their aqueduct system and used water conveyance systems and sewage systems. Also, from the ancient Greeks was Hippocrates, who also identified several diseases, such as malaria. And of course, we know Hippocrates from the Hippocratic Oath, which is what doctors, nurses, and other healthcare professionals take the oath to always do what's in the best interest for the patient and never harm them. Also, an interesting thing about the ancient Greeks is that the government at large became more involved in the public health uh, system of their country by overseeing drainage of sewage systems and ensuring that the aqueduct systems were working properly. In the hygiene movement, the Industrial Revolution caused explosive population growth in cities due to jobs and other things. There was rampant abuse, sadly, of workers, whether it was even children or pregnant women and so on. But with this population growth, there was much needed attention given to the sanitation systems. One of the more notable people of this time is Edwin Chadwick. He was an influential health reformer. He argued that disease caused poverty and health. He argued that disease was the cause of poverty and that health is conducive to wealth of populations, which of course we could see he was obviously right about that. Many countries now that are still developing or very underdeveloped, a lot of the reasons why they have such economic problems is because of their public health and or lack thereof. He reported a lot on the working conditions of laborers and showed that workplaces that were dirty caused sickness in the workers, which is it's funny how we see these things and we think they're so obvious, but at a time this was not something this was not an accepted understanding. He also proved that productivity in communities were obviously affected by the public health and so on. Another very notable figure, his name was John Snow. He was a doctor who is considered the father of epidemiology, which is a major part of the public health world these days. During the cholera outbreak in London in 1854, he studied the water supply patterns, and he found actually that there was a concentrated group of people that were suffering from cholera way worse than other areas, and he found that they were all using the same water source. So he was able to show that the water was contaminated, so if we uncontaminated the water, it would cut down on the amount of cholera outbreaks. Contagion control was the era that began to focus on contagious diseases and how they could be prevented, also known as the age of germs. Louis Pasteur, a very famous person, especially for pasteurization, but he also solved many of the puzzles regarding rabies, anthrax, silkworm disease, and other things that had ran these areas rampant. He was a major contributor to the development of the first vaccines. He established the germ theory, which shows that it's actually microorganisms, living things, that are the causes of the diseases we are seeing in people. He also, with that, debunked spontaneous generation, which was the idea that these sicknesses or these diseases just spontaneously happen, and there was just no real way to show what the real source was. Joseph Lister was a British surgeon. He's a pioneer of antiseptic techniques used in surgery. He used carbolic acid to sterilize surgery instruments and to clean wounds. The post-1950s public health began to shift due to the various civil rights movements for women and underprivileged populations. It expanded welfare and other social programs, and the government became more involved in spreading information regarding health risks. The big one is the first Surgeon General report on smoking in 1964, where Surgeon General Dr. Luther Terry was the first federal government report linking smoking and ill health, including lung cancer and heart disease. And what's incredible about it is you can see in this chart that since the government or the Surgeon General became involved in spreading awareness about the risks of smoking, you could see that there was a decline between the 60s until now, and 58% decline, which is, I mean, that's a lot. Next was health promotion, disease prevention from the 1980s to 2000s, focused heavily on individual responsibility for health due to economic recessions and other problems where public health was either scaled back or neglected. A major focus of awareness and personal responsibility was a result of the crisis of HIV and AIDS. In addition, health education became futile and extremely important on dealing with issues such as HIV and AIDS and also coronary heart disease. Population health in the 20th century. Now, the big move is we are now dealing with new problems that had not been seen before, which are aging populations as a result of the baby boomers, healthcare costs, and proper access to healthcare for underprivileged communities. According to the CDC, there are 10 functions of public health services today. The first is to monitor health status to identify and solve community health problems. The second is to diagnose and investigate these health problems. The third is to inform, educate, and empower people about health issues, which I think is probably the most important thing. Another is to mobilize community partnerships and action to identify these problems. Next is to develop policies and plans that support individual and community health efforts. Next, obviously, would have to be to enforce these laws and regulations that protect health and safety. Also, to link people to needed personal health services and ensure the provision of healthcare when otherwise unavailable. And that's what I was talking about before in terms of lack of access by some of these underprivileged communities. Luckily, now we're at a place where we're actually able to not just look to the rich in terms of their making sure that they're healthy. Now we're looking at from a global perspective that all people are have the right to healthcare and have the right to live healthy lives, whether or not you are rich or you are poor. Next is to assure competent public and personal healthcare workforce. Luckily, we have government agencies and also private agencies that overlook those that work in the public health field to ensure that they're doing the proper job and what they need to get done in order to make a healthier America, a healthier world. Again, evaluate effectiveness, accessibility, and quality of personal and population-based, meaning looking at more epidemiological things where we could study and see how effective our programs and our initiatives actually are. And lastly, of course, we need the research and we need new insights to innovate and to look at things from a different perspective to deal with certain health problems. In my opinion, the future of public health, the greatest achievement the United States could accomplish is to increase and measure access to appropriate, safe, and effective care, including clinical preventative services. The U.S. Department of Health and Human Services state that there are disparities in healthcare quality among racial and ethnic minorities, which is quite saddening. The diseases and ailments that cost the most are many times preventative, whether it be nutrition or smoking. And I use the example of smoking because that's what I wrote about in last week's submissions. And there are over 480,000 deaths each year in America as a result of smoking, costing nearly $170 million, which is just staggering to me. And hopefully within the next 25 years, we can curb smoking through education and preventative measure, that money could be allocated to the minority groups and to the underprivileged people who are still in dire need of very normal healthcare services that all of us do enjoy. Here are my references. Here's the next page of them. Okay, thank you for your time.